Hi, my name is Amanda Nguyen, and I'm an oral medicine specialist in Perth, Western Australia. This is my first video for 2020. Welcome back. I hope you've had a happy new year. I'm excited to bring you a video today on how to perform a cranial nerve examination. This is a simplified version of a cranial nerve exam that can be performed relatively quickly and with minimal equipment. I hope you enjoy. Thank you. How I approach a cranial nerve examination. This is a simplified version and more extensive testing may be performed. First, I would like to share a mnemonic. I am a huge Harry Potter fan. On, they travelled and found Voldemort guarding very ancient Horcruxes. This corresponds with the cranial nerves. There are 12 cranial nerves, and they are numbered according to its anatomical position. Assessment is important in cases of orofacial pain where an odontogenic cause has been ruled out, sensory or motor changes, taste changes, or if there are any unusual presentation of symptoms. This is from a patient of mine who suffered a small brain aneurysm and caused orofacial pain. You also do not want to miss a malignancy. Some general principles when performing the exam include assessing symmetry, so if the left and right hand side have similar results. Any positive results should be promptly referred. When testing one side at a time, block the other side where possible. So cover the eye, ear or nostril on the side that is not being tested. Don't worry, most dentists routinely test some cranial nerves as part of their patient examination. So I approach my cranial nerve examination a little bit differently. I segregate it into an extraoral and intraoral component, and I start from the head and work my way down to the shoulders. This is the way that makes sense to me and I find it quite practical, but there is no set way to do it. A routine is important not to miss any cranial nerves. So I start from the eyes, nose, ears, face, and shoulders. The nerves I've listed here are the nerves that you'll be testing at each anatomical site. For the eyes, you are testing the optic, ocular motor, trochlear, and abducens nerves. With the optic nerve, you'll be testing for visual acuity and fields. You may use a chart for this. For the ocular motor nerve, you are testing for accommodation and pupillary constriction. So you want to see if the pupils constrict with light and also if you move an object close to it. You would want to check the eye movements in 6 directions as shown in the image. To test the olfactory nerve, ask the patient to close their eyes, block one nostril, and ask them to smell something that would be familiar, such as soap, coffee, cloves, or eucalyptus oil. Test the other side. For the vestibular cochlear nerve, you can stand behind the patient, block the other side, and whisper some numbers or a phrase to the patient. I find that if the patient has long hair, rubbing the hair between your gloves also produces a sound. Then I would test it and ensure that it is the same on both sides. For the trigeminal nerve, each branch should be tested, the ophthalmic, maxillary, and mandibular. This means that there are 6 areas in total, 3 on each side, which should be tested. You're looking for touch discrimination, so for the light touch you can use a piece of gauze in each area, and sharp discrimination, my preferred instrument is a periodontal probe. You can get the patient to clench and you'll be looking for bilateral symmetric contraction of the masseter muscles and also symmetric jaw movements. For the facial nerve, you will be looking at facial expressions and also you can ask if there are any taste changes. I get my patient to scrunch their forehead and frown, to tightly close their eyes, and to show all teeth. For the accessory nerve, I stand behind the patient and place my hands on their shoulder. I get them to shrug against pressure and check that both sides is equal. I then put my hand against their face and get them to turn their face towards, and I test that they have equal strength on both sides. Now we move on to the intraoral component. I get the patients to say ah and swallow. You can test for a gag reflex, but I don't routinely do this as the absence of a gag reflex doesn't actually mean a cranial nerve palsy. So when the patient's saying ah, I check for symmetric movement of the soft palate and uvula. For the hypoglossal nerve, I check the patient's tongue at rest to see if it's symmetric, and I also check that with tongue movement and protrusion. So that's all done. Now for a little pop quiz. Do you know what to do at each anatomical site and what nerve you are testing for? I've included some little hints that I hope you find useful. Thank you for watching. Please let me know if you have any feedback. See you!